Yoga has been found to be therapeutically effective in depression, anxiety disorders. It's also been fairly well used and tested in schizophrenia. Of course, in the latter condition, not as the first line of treatment, but when the patients get better with the antipsychotic drugs, but remain with some problems still, then we need to give yoga, and yoga benefits them. In fact, the benefits of yoga in schizophrenia has already been included as a guideline in one of the international guidelines for treatment of schizophrenia. Depression, anxiety, I have already said. There are many other conditions in which yoga is used in mental health. Childhood attention deficit hyperactivity disorder. Some have tried even in autism. People have tried yoga in cognitive failure in the elderly, what we call as minimal cognitive dysfunction. Sleep and many other psychosomatic conditions that include, for example, bodily aches that come because of non-physical disease. Again, yoga has been found to be very helpful. So these are all the gamut of conditions wherein we have used yoga in psychiatric disorders. People who have meditated for several years, those who haven't, they have found that some brain regions are more preserved than the other. One. Second, in elderly people who are otherwise physically well, went through a 6 months of yoga. A scan was done before and after. There are some sensitive areas in the brain in elderly which ought to get smaller and shrink. But on the contrary, in these people, those sensitive areas which work for memory have actually, there is a evidence that it has gained. So it means that yoga has been protective to the brain, enhancing its structure. Now there are many other arguments why brain would get functionally better. Yoga reduces cortisol levels, and cortisol, if in excess, is known to cause some dysfunction in the brain. Yoga also in patients with depression, for example, increases a protein in the blood called as brain derived neurotropic factor, which could well be happening in the brain, and it protects the brain from getting into difficulties, and it also time to time repairs the brain. So brain derived neurotropic factor. And on a functional basis, lot of studies on electrophysiology of the brain, EEG, event related potentials, and we have shown that there is an improvement which is towards the brain functioning better. Some of the procedures of the yoga, for example, chanting Om, we have shown that some regions of the brain actually become cooled down. The activity becomes less. Okay, why does some activity of the brain should become less? These are the areas of the brain which are otherwise in emotionally excited situations, they function more. So it seems there is a neurophysiological correlate of reduced emotionality. So which in turn would make the rest of the process of the brain repair get better. So these are the examples of why yoga would help brain to function and protect it from whatever other insults. Every psychiatrist is using one or other form of yoga. I'll give you some example. Gnana yoga. We do psychoeducation. We improve the individual's understanding of the disease and what he needs to do and what the family needs to do. Gnana. Of course, I don't truly call it the Gnana yoga of the yoga, but in a form we use it. Bhakti yoga. We know that those patients who have had faith in the doctor obtain better benefit. In fact, inducing of the faith is also establishing better rapport. In all psychotherapy, this is one of the important preconditions. Improve the rapport, the person becomes develops more faith in your approaches, and you could work things better. So the Bhakti Yoga. Karma Yoga is something that you are seeing in this very building. Patients with psychiatric disorders who have lost their motivation are motivated to get themselves engaged in activity, get themselves training, and this activity is very helpful. So we use it. Raja Yoga is a form of many other things which include yogasana, meditation, and so on and so forth. This is he himself helps him to get better. All other conditions where maybe somebody else required, and here he applies his mind. The yogasanas come into picture. We use the yogasanas and we use the pranayama, which are very well incorporated as parts of the Raja Yoga. And we have, of course, meditation, which we selectively use. We don't use it in all patients. In fact, meditation is one of the key elements of Raja Yoga. But we know psychiatric patients would have difficulty in getting their minds on to meditate. So we probably limit our business to yogasana and pranayama. And in select conditions, we of course encourage them to do meditation, and it gets them better.